Yeah.
Yeah, Madam Ukinebo, can you hear me clearly?
Yeah, very clearly.
Okay.
Your hair is shiny.
Thank you.
The Edo
Eva,
professionals in diaspora are coming back with their third show on Nebo TV this week, and they have two topics to address. First, alcohol and medication use, the effect of alcohol on different medications, how alcohol can increase and decrease blood medication level. Alcohol and certain medications can lead to liver disease. The combination of alcohol and medication can also cause stomach ulcer. And the second topic is urinary tract infection, UTI, different type of symptoms of UTI, organism involved, special population, young children and elderly, the complications, the diagnosis, the treatment, and the preventions. The program is featuring 3 healthcare professionals, Dr. Dorothy Ayela, Pharmacist Felix Odige, and Dr. Nosahari Obano. Please join us on Nebo TV on February 6th, 1 p.m. Canadian time and 7 p.m. Nigerian time. Feel free to ask your questions, and the professionals will take questions towards the end of the program. See you all on Saturday.
Hello, everyone.
Hi.
Hi. So we are back again on our show, Edo Professionals in Diaspora. Today is our third program since the beginning of this show. And we have 3 healthcare professionals today in the studio. We are here to discuss about alcohol and medication and urinary tract infection. So before we start the program today, I'm going to introduce the healthcare professionals. Number 1 here is Dr. Dorothy Ayela. You are welcome to the program today.
Thank you for having me.
Next, Pharmacist Felix Odige. You are welcome to the program.
Thank you.
And our medical doctor, Dr. Nosahari Obano. Thanks for joining the program today, sir.
Thank you for having me.
Okay. So before we start the program, if you have anything to say, just let me know before we commence with the program.
Yeah, this is the 3rd program for this year. We'll continue to bring program. And like I have said, the governor, citizen, just like everybody of Edo State. So everybody needs to pitch in so that we can all carry the load and make a better state.
Okay. Thank you, sir. Dr. Dorothy Ayela is going to be discussing about urinary tract infection, UTI.
So thank you for having me in this program today. My name is Dr. Dorothy Ayela. I'm a professor and also a nurse practitioner. I do practice in Toronto, Canada. Today we're going to be talking about UTI, which is urinary tract infection. Even though UTI is a simple infection that can easily be treated, majority of our people really do not know how to identify it. They really don't know when to seek help, and hence a lot of them experience complication that is really avoidable and also suffer in silence. So today we're going to be talking about it so that we bring awareness to it, how you can identify it, when to seek help, and we're also going to be discussing some preventions, how to decrease your risk of urinary tract infection.
Thank you.
Yeah.
So hold on, let me quickly do this. Okay. Okay, go ahead.
All right. So can we go to the second track?
Okay.
So urinary tract infection, UTI, is an infection of the urinary system. The urinary tract consists of the kidney. We have 2 kidneys, and the urethra, the ureter, and the bladder. When the infection happens in the ureter, it is a condition called uritis. Sorry. And if it's in the bladder, it's ascites, and if it happens in the kidney, it is called pyelonephritis. Most of the UTI do happen in the lower tract of the urinary system, which are the bladder and the urethra. The next slide, please. So as you can see, the urinary tract, the function of it is really to help the body, clear away the waste product that is produced in the blood system, and also the byproduct is urine. So the kidney is a very small organ that's located at the back. We can easily access it through the back. We have two kidneys. It's just above the hip bone. What the kidney does in the body is to help clean out all the waste product, the fluid from the blood system, and the byproduct is the urine that is being carried through the tiny tube called the urethra to be stored in the bladder, where it waits until it's ready to be excreted out of the body through the urethra. So if you can go for the female urinary system, you can just see the image of the female urinary system here. You can see the two kidneys that is located, we can access it through the back. So once the kidney, filter all this waste product from the blood system, the two tiny tube, the urethra, the ureter, carry this urine to the bladder, where it is stored, and when it's ready to be excreted outside the body, it goes through the ureter. The main difference between the urinary tract system of the male and the female, they're the same. It's just that for the male, the urethra, we have the prostate gland. The prostate gland kind of wrap around at the back of the urethra. So prostate gland in male is an organ that helps produce fluid that is mixed with the semen during ejaculation, so that the semen can travel easily. So like I said before, even though urinary tract infection, UTI is easily treatable, most of our people do not know how to recognize it. And most of the symptoms can be quite bothersome. Some people don't even have any symptoms, but if we leave it untreated, it can lead to a serious complication that can be quite devastating. So we're going to be talking about the complication later on in the show. So what are the common causes of the UTI? Common causes are microorganisms, which is bacteria. The bacteria that is the most common cause is the E. coli. E. coli is a bacteria that normally is found in the GI tract, in the gut. So, that is the most frequent cause of UTI. But there are other causative pathogens that can cause UTI, like the Enterobacteria, Pseudomonas, the Enterococci, the Cephaloccocci, and also the Mycoplasma in some cases. So how do we recognize a UTI? When somebody have UTI, there are some symptoms, there are some signs that the body will be telling you something is wrong. Some people, like I said, may not even have any symptoms. Some of the most common symptoms are frequent urination, the need to want to go urinate all the time. And when the person go urinate, it's like small amount of urine at a time. And there's this urgency, the need to urgently want to go pee, and a burning sensation when somebody is urinating. So because of this frequency and urgency, some people cannot hold the urine to make it on time to the bathroom. So there might be a little bit of leakage, seepage of the urine. In the medical term, we call that incontinence. The color of the urine can also change a little bit. You might see a cloudy urine, a very strong, foul-smelling urine. Some people might see blood in the urine. the way you can tell that it's blood in the urine is it might be bright red, it might be pink, it might be like the color of cola. Those are all indication that there's blood present in the urine. Some people experience pain on the side of their body. We call that a flank pain. Some people might experience pain in their abdomen or in their pelvic region, just around the pelvic bone, the hip bone. Other symptoms of a UTI are pain during sexual intercourse. In male, they will experience pain in their genital area, the penile. There might be a general fatigue. You just feel tired, even from doing nothing at all. You just feel exhausted. And we've already talked about the pain on the side. And also some people might experience just back pain because, you know, the kidney, we can assess this from the back. If in some cases that the infection has made their way up to the kidney, some people might be experiencing lower back pain. Fever, chills are all signs of a UTI. Vomiting as well. Nausea is most common. People feel like they want to throw up, but there's nothing to throw up. In the older folks, there might be a condition called delirium, where they suddenly just lose their, they become confused. The reason why that is the bacteria has made its way to the blood-brain, to the brain, that is causing acute change in their mental capacity. So how do we diagnose it so that we know this is a UTI? We want to do a common, the most common test that we do to confirm that it's a UTI is the urine analysis and also urine culture. The urine analysis is just taking a little sample of the urine, where they take it to the lab and test for the presence of bacteria, red blood cell, white blood cells. And the urine culture, very useful because it tells us if bacteria is present in the urine and what type of bacteria is present in the urine, so that can guide the type of treatment, the medication that you're going to be prescribed and how long you're going to be prescribed that medication for. Sometimes, you know, when you do a urine culture bacteria, you might not see, that culture might not detect another form of pathogen that can cause a UTI, which is the mycoplasma. So not until you request specifically for it, the lab is not going to test for that. So if a client come and they say they're having all the symptoms and you're not finding any bacteria in the urine, maybe you want to request that. The other thing that we do to diagnosis is we can do abdominal ultrasound. Abdominal ultrasound is a visual image of the internal organs, just to see the status of the bladder and also the kidney. A cystoscopy is also done sometimes. It's just a lens, you know, going into the urethra to the bladder just to see how it is. And the CT scan is the ultimate. You know, if all heads fail, they do a CT scan that give you like a cross-sectional view of the organs. So once, you know, it is diagnosed, is confirmed that it's a UTI, you know the type of pathogen that is present in the urine culture, the treatment recommendation is usually antibiotics. So antibiotics, you know, the test will also tell you, okay, there's E. coli present, it is sensitive to these antibiotics. These are the class of antibiotics you can choose from that will respond to it. So we use nitrofurantoin, the sulfide drug, the Bactrim. So duration of treatment lasts from 3 to 10 days, depending on the organ, the bacteria that is causing the UTI and how severe it is. It depends on so many factors. So your doctor or your nurse practitioner can guide you through that once the test result come back. So when prescribing antibiotics, it is very important that we do a lot of health promotion teaching to our client, because most patients, when they prescribe antibiotics, they don't finish the whole course of the duration, because once they start taking it for a day or two, they feel better, then they said, I'm good now, and they stop taking the medication. That is the last thing you want to do. You want to make sure you finish the whole course of the antibiotics as prescribed. The reason why that is if you don't finish the whole course of antibiotics, you are now creating a situation where you become resistant to antibiotics in the future. If you need that type of antibiotic, it might not respond. The medication might not respond because you have created a resistance to it. So most of the simple UTI, if left untreated for a very, very long time, can make their way up to the kidney and can cause a lot of serious damage in the kidney. So that is why it's important for you to look out for the signs and symptoms and seek medical help right away. So some of the complications that can happen, the most serious one is the damage to the kidney if it is not treated on time. We can also have sepsis. Sepsis is when the bacteria now go into the whole system. It becomes systemic into the blood, and that can be quite serious, can be fatal, if it take a strong hold. Increased risk of preterm birth, low birth weight during pregnancy. Some people, it can impact their genital areas, that they can have some strictures in their urethra because of the infection has been there for a long time, and the inflammation has been there for a long, long time. So we have what we call a special group of people, special population, which are the very young and the very old, the elderly. The reason why they are called special population is that they do not present with the classical signs and symptoms of a UTI. So as a result, majority of them don't seek help for it. They are misdiagnosed, they are not treated for it. So for babies, for example, the only symptoms that they might present is that the baby become a little bit more fussy and cry a lot. The mother cannot settle the baby down. The baby doesn't want to eat. Sometimes when you're changing the baby diaper, you can see the strong color urine and it smells really, really bad. Those are indication that there's something wrong. You want to go take your baby right away to be seen by the medical professionals. Same thing with the older folks, the elderly people. They might not have fever or frequency to urine or all that symptoms that we talk about. All they might have is incontinence. That means they're peeing a lot. They having accident. They're wetting themselves, and sometimes they might become confused, which is called delirium. So when any geriatric client comes into the clinic and there's sudden change in their mental capacity, the first thing you want to do is to rule out a UTI. So, in anything, the key is you want to prevent it. You want to help do certain things to decrease your risk of getting it, so that you don't have to go through the symptoms and all the treatment and all that. So part of prevention wise, we set to practice a very good personal hygiene, especially for our female patient, women, because in the women's the way the women body is designed is that the vagina and the vaginal opening and also the rectum, the space between them is very short. So things can move back and forth from the rectum to the perineum and can introduce bacteria that way. So we recommend that when they finish using the bathroom, for them to wipe from the front of the vagina to the back to the rectum, so that you don't bring anything from the rectum to the front. And during the menstrual period, we also recommend changing your pad, your tampon very frequently. You don't want to leave a tampon in there for more than 2 to 3 hours. You got to keep changing it, because if you leave it there for so long, bacteria can make their way through there, and then you can increase your risk as well. using a feminine deodorant, like douching, like things, some women believe that they need to wash inside the vagina really, really good to smell good. You don't have to do that. The vagina is self-cleaning, meaning it cleans itself. You don't even have to do any special thing. Just wash it with water, and off you go. Because when you douche and you introduce all those chemical in there, it can be very quite irritating to the tissue in there and can increase your risk of a bladder infection. Drinking plenty of fluid. When we say fluid, we say water. Water is your best fluid. It keeps you hydrated. It flush out all those toxins, all the irritant from the system. And it's recommended you drink about 6 to 8 glasses of water every 24 hours. And try not to drink too much caffeine, which is coffee, tea, beverages like soda. All these irritate the bladder. If people, from personal experience, if you drink too much cup of coffee, you notice that you go to the bathroom all the time because those are irritants. And also cranberry juice has been, shown to decrease your risk of a UTI. So the other thing is we want to be going to the bathroom often to pee, to urinate, every couple of hours. You don't want to be holding your pee. If you need to go. Because two things, if you hold your pee there, bacteria love any pool of fluid. They can fester in there. Plus also over a long time, holding your pee for a long time can make your bladder weak and can increase your risk of having incontinence, not able to hold your pee. So using a lubricant during sexual intercourse is also recommended. You want to use a water-based lubricant, not the one with chemical or spermicides in it. If you're using a birth control family planning, the diaphragm has been shown to increase the risk of UTI because when we're going to put the diaphragm into the vagina, up into the cervix, that can, introduce bacteria along with it. So you might want to look into other options of family planning or birth control. Clothing also is another issue. If you wear tight jeans, tight fitting clothes that increase your crunch, it can be a little bit uncomfortable, which can increase your risk. So you want to wear loose fitting clothes. For men, you want to be wearing boxers. For female and for everybody, you want to be wearing cotton underwear. Cotton are breathable, so they allow hair to circulate, keep the area dry. But if you wear synthetic material, it kind of encourage moisture, and bacteria love a dark, moist environment. So that is the way that increases your risk for UTI. And the other thing is a G-string. A G-string is a type of underwear that women like to wear. It's like a string that moves back and forth, right, as you move about. So in the process of moving back and forth, it can introduce E. coli from the rectum to the urethra. So you want to avoid using a G-string as much as possible. For women that are menopausal, we also want to, recommend estrogen-containing vaginal cream for them because during menopause, you lose estrogen that really protect women and make the vaginal flora moist and less irritated. So in menopausal years, you lose estrogen and that area becomes dry, irritated, increase your risk of a UTI. So with discussion with your medical professional, they can prescribe estrogen-containing cream for you to insert in the vaginal area. So that's just the gist of the UTI. Like I said, it's a very common and simple treatable disease process that, the key is recognizing the signs, when to go see your doctor or your nurse practitioner, and also practice all these preventionary measures to help decrease your risk in the future. So thank you, everyone.
Wonderful presentation.
Thank you.
Congratulations.
Excellent. So my first question to Dr. Ayela, who just gave a very beautiful presentation, and this tells you the quality of Edo people that we have, and we will continue to support our state. If a man comes in with, telling you that, I have this white stuff coming and I have a burning, and then they've been treating him, will you check for uroplasma auriculum, which is an kind of out of the boundary organism that a lot of us don't check for?
Good question, sir. Yes, in the clinical practice, if a man or female, comes, with discharge, pulsy discharge and all that, and they have burning sensation in their urine when they're voiding, I look for many things other than a UTI. UTI would be my first suspect. And for the UTI, they don't really test for the microplasma as the source of infection for that. So you have to request it. And in conjunction with that, I would do an STI testing as well, just to see if it is more than just a simple UTI, because mycoplasma can cause a UTI, even though it's not common. And for you to get it, you have to specifically request for it. I will also just, in line of that, test for STI like chlamydia, like gonorrhea, just to make sure that it's not what we call a concurrent disorder, meaning there are multiple things happening at the same time.
Good. So you are actually saying that getting out of the box, not just concentrate on the E. coli. So you're getting out of the box.
Yes.
You're looking for other things that can be a problem, that can cause strictures, sterilization, mostly for women, right, which is a way medicine should be practiced.
Right.
Also, I'd like to bring you back. How will you comment on nitrite positive urine and leukocyte positive urine?
Nitrite positive, in a clinical setting, the first thing we do before we send to the lab is just to do a urine dip. Mm-hmm. If a urine dip shows there's nitrite present, I will just assume I'll still send the culture to the lab to be specific in terms of doing a culture analysis on it. But I will proactively just treat for a UTI. That's the way I usually handle that, because that's the best practice. Mm-hmm. And if at all the lab come back and say, hey, it's more than this, and the antibiotic that I've chosen is not sensitive to what is a causative pathogen, then I can change the antibiotic recommendation as well.
Concord with you. Yeah. Excellent.
Thank you.
Yeah.
Commonly, UTI is not it's not a sexually transmittable infection, but there are some odd cases that, the mycoplasma and also chlamydia can be some of the pathogen for the UTI, plus there's an STI present. But, ordinarily, a UTI is not sexually transmittable.
Thank you.
And just to add to those, a common practice that we see now in young people who are involved in anal sex. So they go into the rectum of the female, and then they go into the vagina. So like she said in her presentation early, E. coli from the GI tract is one of the biggest offenders. So people who are practicing anal sex, they go from the rectum into the vagina, they introduce this organism into the vagina, which can also cause UTI.
Interesting.
Thank you.
Thank you for that, sir.
There's a question here.
Okay.
There's a question.
At the end of, okay, you can read the question. I'll read the question to the audience.
By Success EU site Bovu. It says, thank you, Dr. Dorothy. Please, is there any relationship between UTI and toilet infections?
Yeah, the main relationship is once you go use the bathroom, which is, the toilet, and somebody else have done a bowel movement there, and maybe invisibly on the toilet seat, And in the process of you wiping yourself, if you wipe from the back to the front, so remember, E. coli is a common causative organism for the UTI. You can introduce that E. coli into the urethra. So that's why it's very important. Once you finish using the bathroom, wipe from the front to the back, and you want to wash your hand thoroughly. Okay, so because that's the only way you can catch it from the toilet is by the way the hygiene process that you participate in after you finish using the toilet.
Okay, I have a quick question there, Dr. Dorothy. Okay, the E. coli is found in feces, right?
Yes,
The
yes,
feces. Okay.
correct. Correct.
Okay.
It's in it's in the feces and also in the rectum, in the digestive tract, where the feces stay before it comes out, right? So E. coli is a high content of E. coli there. So when we go use the bathroom for number 2 bowel movement, it is important you wipe from the front to the back, right? And it's also important afterwards to really wash your hand so that you don't take that contaminated hand, and touch somewhere and then introduce it into the urethra like that.
Well, I have a question for you. I, as a GI physician or a gastroenterologist, I am usually one of those who advocate for when you do antibiotics, you do probiotics. And one of my pet peeve for probiotics is eating yogurt. So do you want to comment when you treat this, mostly the elderly people, when they take these antibiotics, if they need to eat yogurt at the same time, which is available in Edo State?
Well, for good question, sir. For a good health, a good health promotion practice, we encourage our client to, invest in a probiotic yogurt. What that does is it can align the digestive tract and also the vaginal tract with the good bacteria that's going to protect you. So it is a common practice to, just participate in yogurt, on a daily basis as well. I do recommend that. And also when we prescribe the antibiotics, we want to be in some of the side effects of the antibiotics is that it give you diarrhea and all those side effects. So eating yogurt will also help you. And also for women that are on birth control, I usually educate them that when I prescribe antibiotics for you, it can decrease your birth control efficacy. So for that whole month, you want to use a backup method, which is condom 100% of the time. Because if your birth control is less effective because of the antibiotics you just took, and you're not ready for a pregnancy, so you want to protect yourself 100% with a condom for that cycle, so that in the following cycle, your birth control come back into 99% efficacy.
Excellent.
Okay, I have one question with regards to the yogurt that you just mentioned. So, drinking yogurt will help to prevent UTI or it will cure UTI?
It help prevent, decrease your risk.
Okay.
And it's a good practice, just because the yogurt will line the GI tract with a good bacteria, and also with the vaginal tract with the good bacteria. The way I explain it to my patient is that in the GI and the vaginal flora, we have the good and the bad bacteria coexisting. So sometimes when irritation comes in, it kind of wipe out the good bacteria because the good bacteria are really, really vulnerable, right? So when the irritation sets in, the inflammation sets in, then the bad bacteria now have opportunity to fester because that's where they thrive the most. So to help yourself to decrease your risk for good health practices, participate in probiotic. And if you don't have yogurt, you can just buy probiotic tablet. You take at least 1 or 2 every day, and that's going to build up a lot of the good bacteria in the GI tract and also in the vaginal flora, so that your body, the good bacteria, have a better chance of fending off the bad bacteria. So that is the way it decreases your risk of a UTI. It's not the treatment for it. It just helps you decrease your risk and prevention.
Thank you, Dr. Dorothy. Interesting.
You're welcome.
Interesting. Nice.
The Edo professionals in diaspora are coming back with their third show on Nebo TV this week, and they have two topics to address. First, alcohol and medication use, the effect of alcohol on different medications, how alcohol can increase and decrease blood medication level, alcohol and certain medications can lead to liver disease, the combination of alcohol and medication can also cause stomach ulcer, and the second topic is urinary tract infection, UTI, different type of symptoms of UTI, organism involved, special population, young children and elderly, the complications, the diagnosis, the treatment, and the preventions. The program is featuring 3 healthcare professionals, Dr. Dorothy Ayela, Pharmacist Felix Odige, and Dr. Nosahari Obano. Please join us on Nebo TV on February 6th, 1 p.m. Canadian time and 7 p.m. Nigerian time. Feel free to ask your questions, and the professionals will take questions towards the end of the program. See you all on Saturday.
Welcome back, everyone. The next presentation today is going to be Pharmacist Felix Odige. Are you ready for that, sir?
Yeah, thank you.
Okay.
Okay. Good afternoon, everybody. Today we are going to be talking on alcohol and medications. I am going to majorly focus on the common medications that people take for granted, medications that you can easily find from the counter in the pharmacy, like over-the-counter medications, and the prescription medications. I will begin by saying that alcohol interact in different ways. So we have alcohol can make your medication less effective. It can make your medication the side effects, increase the side effects and make the medication to be toxic to your body system. It can also make the side effects of the medication, the natural side effects of the medication to be worse. So, and also mixing alcohol with the medication can also introduce new symptoms into the patient, the person that is using the medications. So, and in some people, take alcohol with some medication can make them to. Alcohol naturally is a depressant and can make somebody to be tipsy. So if you take alcohol with some medications, that degree can increase. So we want to start with the regular painkillers that we all know. We last time we talked about the aspirin. We talked about the naproxen.
Do you want to help? Hold on, sir. Okay. Do you want to show us the boxes?
Yes.
Okay.
So we talk about the aspirin, Advil, it's also called ibuprofen, and Aleve, which is also called naproxen. These can be obtained without the doctor's prescription. So these group of drugs, they belong to a class we call non-steroidal anti-inflammatory drugs. So alcohol can, when taken together, can cause a lot of issues. With aspirin, for instance, it can cause irritation of the stomach and may eventually lead to bleeding issues. Then that can also happen when you take Advil and naproxen, which is Aleve, with alcohol. Then we also know we want to talk about drinking alcohol while taking acetaminophen. In Nigeria, it is called paracetamol.
Yeah.
In North America, we call it Tylenol or acetaminophen, but in Nigeria, it is called paracetamol. Paracetamol is commonly used by majority of persons all over the world. So if you drink alcohol and you take paracetamol, because they are both metabolized by the liver, they are both broken down and taken care of by the liver, we find a situation where the liver concentrates more on alcohol and leaving the paracetamol or the metabolites of paracetamol to accumulate, and that can lead to liver damage. I am really serious in discussing paracetamol because I have seen even some of my friends, when they are about to take paracetamol, they use a glass of either beer or even hot drinks, and that is a very dangerous culture or practice. And I want to categorically appeal to the people that are watching this show this afternoon or this evening, not to stop the practice if you do it, and tell your friends too that are not able to watch us today. Slide. Then we also have some preparations like cough syrup, Sudafed that contains pseudoephedrine, and we also have something like this. We can call it Tylenol, cold and sinus, and they contain pseudoephedrine also. And we also have the Nyquil. When they are taken simultaneously with alcohol, they can actually increase the drowsiness effect of the medication, and that can cause problems. If you're drowsy and you start driving, it can lead to accident. It can lead to excessive sleepiness and other issues. So it is not advisable to take both together, alcohol and decongestant or antihistamines. Then we also want to talk about anti-anxiety medications or sleeping pills. There are people that will go to the doctor because they are not able to sleep, they have sleeping difficulties, or they have anxiety. Then the doctor normally will choose from this class of medications. We have the lorazepam, which is called Ativan, and we also have alprazolam, which is called Xanax, and we have diazepam, which is Valium. And from my own experience, Valium and the lorazepam are mostly the drug of mostly misused. They are mostly misused and abused in not just only in Nigeria, all over the world. So when you take alcohol, you use alcohol while taking this class of medications, it could, can you take it up, please? Okay. It could cause excessive sedation, and some people can actually, from that sleeping sedation, go into state of unconsciousness. So it is highly recommended that you don't take both together. Then we also want to talk about medications that are used for angina pectoris. Angina pectoris is like chest pain or chest discomfort. It's due to coronary disease. It occurs when the heart muscle doesn't get enough blood as it needs. So this usually happens because that is a condition that we normally will refer to as ischemia. So when you take alcohol with this class of medication, then the alcohol causes vasodilation, and you discover that the blood vessel gets bigger. So medications like high blood pressure and the nitrate, the prominent example of nitrate is nitroglycerin sublingual. Normally, the doctor will advise that you have that and you spray the stuff under your tongue. You spray it under your tongue, and that will decrease the discomfort.
You have it there, sir. Sir,
Okay.
do you have a box of what you are describing,
Yes,
right?
yes, I do.
Okay,
I do.
you want to show it to us?
Okay. This is what we call nitroglycerin sublingual. So when you have that chest pain, the doctor will tell you, okay, spray one dose underneath, under your tongue, and wait for about 5 minutes. If it is working well for you, it's going down, not completely gone, take a second dose. Then you are encouraged to do that up to 3 times. If it's still there, then you have to go to the hospital or call emergency. So this group of medications can now cause excessive drowsiness. Can we go back to the slide, please? Okay. Okay. So it can lead to dizziness. It can also lead to fainting. Sorry.
Hold on. There's something wrong here. Okay.
So this can lead to dizziness. It can lead to fainting, and it can also lead to very fast heartbeat. We call it arrhythmias that can actually take some people to the emergency. So it is highly recommended that you do not take alcohol with nitrates. Then we also have erectile dysfunction medications, which is, if you can take me back, I just want to show them these 2 examples.
Okay. Hold on.
Okay. So we have the Cialis, tadalafil. Then we also have Viagra. So this group of medications, you can go back to the slide, please. When taken with alcohol, it can significantly lower the blood pressure, because alcohol on its own can lower the blood pressure. So if you take both together, and it can cause further lowering of blood pressure, dizziness may occur, flushing may occur, severe headache may occur. And alcohol on its own can actually also cause erectile dysfunction. So taking both together will actually negate the effect of the Viagra or Cialis. So alcohol must be avoided altogether. Thank you. Go to the next slide, please. Then we have, I specifically put this on a separate slide. This benzodiazepine, what we mentioned before, Ativan, which is lorazepam, clonazepam, and Valium, they belong to this family. So, and if you use them, and there are other examples in this class. There are other examples in this class. And at the end of the day, dizziness, slowed or difficult breathing, inability to coordinate very well, these all could lead to accident, vehicle accident or physical accident, even in your own room or your own house. So there are some people that will experience unusual behavior, memory problems, blackout can also happen, even liver damage. So my advice is, when you are taking these medications, don't combine them with alcohol. Next slide, please. Then we want to talk about antibiotics. Common in this group, metronidazole, which is Flagyl. It's called Flagyl. It's also called metronidazole. Normally used for infections. Drinking any amount, listen to me, drinking any amount of alcohol with Flagyl, for instance, will result to nausea, violent nausea and vomiting. It could also people can feel irritation of the stomach, and that some people could actually end up in emergency. So also in this group of antibiotics is called what we call macrobid. Macrobid. The generic name is frontoin. So when you use these medications together with alcohol, there's going to be serious consequences. So the advice is do not use. Then we have some medications that are used to treat epilepsy or convulsive disorder. So when this is funny, and I want everybody to pay attention to it. Dilantin and Keppra are some of the common medications in this class. So you have to avoid drinking alcohol with them. The reason is that alcohol actually causes a problem in two ways. Number one, it could increase the side effects of phenytoin, which is Dilantin. So that will lead to toxic blood level of the medication. And some of the side effects could be trouble in sleeping, headaches, swelling or bleeding of the gums, and nervousness. Then that is when you take phenytoin, Dilantin, and you drink alcohol. But if you're an alcoholic, the doctors will normally refuse to put you on this medication, because if you drink alcohol consistently and you take this medication, what will happen is that alcohol will decrease the enzymes that normally would have broken down or metabolized this phenytoin. So that will now lead to therapeutic failure, treatment failure. So that will lead to worsening of epilepsy. And you may not know. You could think that the medication is not working. It's just because of the alcohol that you're drinking. So I will strongly advise that you don't drink alcohol while taking this medication, and you don't take this medication simultaneously with alcohol. Then we also want to talk about unethical, unprofessional habits. Especially, this is very common now in Nigeria. You see some people, men, they want to prove themselves before their female counterparts, and I don't know how they got this. They will mix tramadol with alcohol. Can you take it up a little bit, please? Can you take the slide a little bit? Yeah. Okay. So tramadol and alcohol. Now, what tramadol and alcohol will do, it will lead to significant impression of the firing of the neurons of the brain, leading to coma and even death. Every activity we do is controlled or managed by the neurons in the brain. The brain is wired with neurons. That is why you are able to even see. That is why you can move. That's why you can hear. That's why you're able to recognize the bad from, you're able to do physical stuff. Without the neurons firing at their capacity, you can't do much of these things. So if you take tramadol and alcohol, what it does is it will suppress in the brain, suppress the firing of the neuron. So people can go into epileptic fit like conditions, and it can lead to state of unconsciousness, and can even lead to people going into coma and eventually dying. So at the end of the day, my brothers out there, don't do it. If you are fond of doing this, or if you have ever practiced it, stop it. Because the end result is going to be painful for everybody, loved ones, yourself, loved ones, and even friends.
Yeah.
Thank you. So,
that's the end of the presentation.
So at the end of the day, it is very simple. When you are taking this group of medications, don't drink alcohol. Even any other medication you want to, just take a full glass of water. That's all. And resist the urge to drink alcohol. Because I know, like I said at the beginning of this program, I know of friends who even do that. And, we just see it as a joke, as a common practice, but at the end of the day, the end result is not something, it will definitely lead to unpleasant consequences. Okay. Now, antibiotics like Flagyl, like macrobid or nitrofurantoin, they cause a condition we call anti-boost reaction. So what they do is the Flagyl or macrobid, nitrofurantoin, will actually make the degradation of alcohol. They will interfere beyond acetaldehyde level. That acetaldehyde is very, it causes a lot of problems in the stomach, in the gastrointestinal tract, and even in the entire system. So when the doctor will say, okay, some doctors will want the patients to take it for 5 days, take one tablet 2 times a day or 3 times a day. Okay. In case of Flagyl, macrobid 1 capsule 2 times a day for 5 days, for 7 days, even for 2 weeks, depending on the degree of what they want to treat. Right. So 5 days after, even if you want to do a social use of alcohol, 5 days after, after you have finished the treatment regimen, that is when it is a little bit safe for you to, because some of this medication, they still stay in the system even after the tests are gone. So you have to make sure 5 days to 1 week.
Yes.
There's nothing like, social, no, just wait. Because you want to treat, you want the treatment to be successful, and you also want to live trouble-free after the treatment history. So 5 days, 1 week, and if you can even go to 2 weeks, fine, as much as you can. So that is what is recommended.
Thank you. Thank you. Any other person? Dr. Barnard, do you have any question or anything to add to the presentation?
What I have to say is that the quality of this program continues to improve. And as you can see, these 2 people who presented today shows the manpower, the education, and the brain that is in Edo State. Those 2 presentations is what I rated as one of a high-ranking presentation. So regarding the alcohol and medications, the Tylenol and alcohol is usually a problem that we see mostly here in California. As a GI doctor, I see quite a bit, because some of these kids who are I'm trying to be very careful with words, commit suicide, who take alcohol and paracetamol. So I'm trying not to use that word, emphasize on this so much, because it may become a practice for people back home. So for that reason, if somebody wants to self-damage alcohol and paracetamol, it's a problem which our brother Felix emphasized. But I think both presenters covered everything in detail. Very, very detailed.
Thank you.
Thank you, sir.
Thank you.
Thank you.
Mrs. Ukinebo or Basekima, do you have any comments in the comment section?
Well, there's a question here by Dr. Osemigi Obano.
Oh,
He
okay.
said, or she said, I don't know if it's a girl. He said, of what importance are these medical professionals to our today decaying health services in Africa and Nigeria?
Sorry, can I just chip in something? We should be magnanimous, and what our purpose for this is not to showcase our talents. We're talking to the common man in the street. People are dying of liver disease. So you don't need medical decay for somebody who went to buy paracetamol to treat headache or to treat fever, and is drinking, using alcohol using alcohol with that. So we are talking to the common people, the street people. We want people to, you as a medical doctor, you know this best, that even though we say the facilities are decayed or they are decaying, not the professionalism. The best, even in diaspora, the best doctors, the best pharmacists, the best nurses are gotten the pool. The majority are from Nigeria. People in those states that will come from. So if the facilities are decaying, the people are not decaying. So we speak to the people. Yeah.
Right.
So Dr. Obano.
Yeah, and also that's a good answer. An educated person is the best person you can have. So if we can educate our people,
right,
you've imparted to them things they need to look out for, things to prevent.
Right.
So a decay facility and educating the people are two different things.
So can I say something?
Okay. Yeah, go ahead.
Go ahead.
So, I guess the purpose of this forum is for health promotion, health awareness. We want to empower the people. Because here in North America, it is the people that come and tell you, because they are usually the health expert of their own health. They come to the doctors, this is what I'm experiencing, I think something is wrong, before even the doctors or the medical professional can, try to do, based on their expertise. So, when we empower the people to take charge of their health, you will find that the health of the population really, the health outcome really improve. So that is what I believe is the forum is here, empowering our people to take charge of their health, to know those signs and symptoms early enough to go seek help for it. Because majority of the time for common illnesses that doesn't have to result in fatal catastrophe, people don't know. So I think this forum is very, very important.
Yeah. Thank you, Dr. Dorothy.
Thank you.
Okay. Like what we explained at the beginning of this program a few weeks ago, that because of the COVID, right now, the global pandemic, we are very limited in our services. Right now, we're going to start with giving awareness through online programs. Later on, we can be physically supporting people back there in Edo State. As everybody can see, we cannot visit Nigeria now because of the lockdown, and we cannot do too much now. That is why we restricted it to online, giving health awareness to our people until the COVID is over. then we can support our people who can do any kind of services like donations, medications, and there are many other things that we are planning to offer the people of Edo State. But for now, we are limiting it to only online. So I will leave it to Dr. Obano to also elaborate on this.
Yeah, coming up on this program, we'll be having a head and neck surgeon to speak with us. And then we'll also have an Edo person from England who will be talking on diabetes. We will continue to make this forum and this program to be more sophisticated, as you see from the two presenters today, that the sophistication is there. The presentation was extremely beautiful. There's nothing that you could add to it. The language was adequate. As I always say towards the ending of this program is that the governor of Edo State, Godwin Nogegase Obaseki, is just a citizen like you and me and everybody. He cannot be the carpenter. He cannot be the bricklayer. He cannot be the doctor. He cannot be the nurse practitioner. He cannot be the pharmacist. We all have to carry our own part.
Yes.
If you live in a street, the street is dirty, park the little young men in the street to clean the street.
Right.
You can plant flowers along the street and make the area beautiful. The governor does not need to tell you that. He does not need to award a contract to get that done. So as professionals living abroad, we are doing our part by empowering our citizens in Edo State on what to look for to take care of themselves. A healthy person is somebody that can be able to do other things in the society. So with our two presenters today, I want to thank you for this sophistication and the high presentation that you brought to the Edo people. Thank you.
Thank you.
Thank you, Dr. Bano. Yeah, Mr. Felix, do you have anything to add?
First of all, I want to say, Dr. Bano, the doctor that asked the question, please, I didn't mean to. If my language feels a little bit out of the line, I'm sorry. I was just trying to explain things, and we do appreciate what you guys are doing there. So at the end of the day, eventually we will achieve our aim for our respective professions, and we'll be happy seeing the patients and everybody doing well in their own fields. So I want to thank Dr. Bano. I know he's a very busy man, very busy doctor in California. Thank you for your time, and I also want to thank each and every one of us. If there's any area that you feel we have not adequately dealt with, you are very free to send the questions to each and every to either Mrs. Obaseki or our host, Nekman Obaseki. Thank you.
So, yeah, thank you, sir. I'm trying to read this comment over and over again. It's just a question that of what importance are these medical professionals to our today decaying health services in Africa and Nigeria. So, you know, he's talking about Africa as a continent.
Well, as you see, I guess he wants to be general.
Yeah.
But I have not been to Ethiopia. I have not been to Uganda. And this program is specifically
for those things.
Everybody can benefit, Nigerians, Edo State in particular, because we want to give back to our states. I don't know whether professionals from other states are doing that, but if they are not, then they can borrow from us the positive attributes. So, like we answered the doctors there, the nurses, the pharmacists, the lab techs, all other professionals, bankers and all, they are doing well individually. And some of the government are also trying, this is a political program. We don't want to go into politics. We just want to bless people. So I guess that probably will have answered the question, madam.
Yeah.
That is it.
Yeah. Thank you, sir. Thank you. So, Dr. Bano, Manda Ukinebo or Basaki, is there any other question there that you can bring
There is a question here, but I don't even understand it, let alone read it.
Okay.
And Jolly Omoruyi said, more to you all in Jesus' name, more grace to you all the doctors, and thank you, Edu professionals. Then that's Sussex, so that Jolly Omoruyi and Success, Osaibo said, thank you, Edu professionals. Then one Igwe, Glory Igwe. I don't know if this is a question or a statement.
It's a statement. Just put that one. I saw that already.
I should read it or
no. That one is not about this program. So thank you, Dr. Dorothy. Please, is there any relationship between UTI? We have already answered that, right?
Yeah.
Okay. So our next program will be next 2 weeks. We're going to be coming back. It's still based on a healthcare system. We're going to be discussing about Dr. Bano, what is our next program again?
Our next program is on the 20th, if I'm right.
No, the topic. Diabetes.
No, the next topic is going to be head and neck cancer.
Oh, okay.
Yeah. So we're going to have a presenter who is going to present on head and neck cancer. We're also going to have a dentist who's going to talk to us about the relationship between cleaning your teeth as well as other health issues that can result from poor dental hygiene. So that would be the two that we're going to try to marry together in the next 2 weeks coming up.
Dr. Dorothy, thank you so much. Mr. Felix or DJ, you have been working so hard. Thank you. Or Madam Ukinebo Obaseki, those who have been working behind the scenes to make this show. For all our viewers, if you have any question, please email us at edoprofessionals.diaspora@gmail.com. Okay, we're going to answer your questions, and see you guys next 2 weeks.
Thank you.
Thank you very much.
Thank you.
God bless you.
Edo Professionals in Diaspora program is a team of skilled and experienced Edo professionals in diaspora who are willing to use their professional skills to support and effect change in Edo State. The program is designed to give opportunities to Edo professionals in diaspora who are concerned about the plight of the people to voluntarily use the skills, wealth of knowledge and experiences to provide support to individuals, families, groups, and communities in Edo State. In the same vein, Edo citizens in diaspora can equally benefit from the program. Their primary goal is focused on providing online and physical support to Edo citizens, such as healthcare services, donations, online programs, professional trainings in engineering, finance, social services, physical support, training and donation of computers, and more. Let's join the state government to move Edo State forward. The program is scheduled to commence in January 2021 in collaboration with Nebo TV Canada and Edo Diaspora Women for Governor Gordon Obaseki. The program is organized by Dr. Nosahai Obano, Mrs. Ukinebo Obaseki, Mrs. Adesuwa Obasoha, founder Edo Diaspora Women, Mr. Felix Odigie, Nekme Obasoge, and Austin Osawaru. Come, join us in this quest to move Edo State forward.
Edo must move forward. Move forward. Backward never.
I think we can go.